On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block here at ACC at the annual meeting in Washington, D.C. The whole issue of whether or not you need on-site surgery doing PCI, even in the acute setting, has been studied extensively, and now we have more data to actually support whether or not it's appropriate. With me is Bill Baumer from UC Davis in California, and the California trial is important, Bill, because it's the largest state, has a lot of patients. Tell me about your trial, tell me what you found.
It was very interesting. Obviously, one of the concerns, can you do PCI at hospitals without surgery on site? We reevaluated that in California with a large trial of over 153,000 procedures, over 200,000 PCIs total. And what we found was that PCI at hospitals without on-site surgery was as safe or safer in some situations than at hospitals that had surgery on the hospital site. We found that that was statistically significant. The other thing that we looked at was how often does a PCI patient need emergency cabbage at a hospital? It's very low both at off-site and on-site hospitals, less than 0.2%. So literally less than 1 in 500 patients are going to really have to go emergent cabbage in that following a PCI. So it's not really needed in that situation. Further, we went on to look at the variation or the variance in each of the performing hospitals. Interestingly, we found that the off-site hospitals did as expected or better statistically. And when we looked at our 120 on-site hospitals, we found that 8 performed better than expected, but 6 actually performed worse than expected and had increased event rate, contributing to mortalities that were about 50% higher than the as expected group, showing a significant variation.
So let me just cut in on this one, because that's fascinating, because you'd expect them to be a little better, the on-site hospitals, and yet some of them don't perform well. What does that mean for you in California? I mean, obviously you got to follow this up, right?
Well, these are all risk adjusted, so we've gone through 200 variables to risk adjust, so there appears to be a significant variation. And I think we have to get back to those hospitals, their operators in the hospitals, and say, let's look at your whole process and see how we can reduce the event rate in those patients.
Okay, so let me just review for myself. It seems as though certainly off-site hospitals do as well, if not better, according to, at least in California they do.
Correct.
Maybe there's great operators in the off-site hospitals, but whatever. On-site hospitals do very well. Some of them may not do as well as others. From a quality issue going forward, which is really where all of this is going, I think, Bill, what's the next step?
Well, I think 2 things. One is we have to work with these hospitals that are off-site outliers to get them to improve their event rate and reduce it. There's 2 ways of doing it. One is reporting back to them and working with them. The other that we're considering in California is what's called public reporting. As controversial as it is, once this information is publicly reported, there is a concerned focus by the hospital and the operators to try to reduce that. That is publicly reported in a few states in the U.S., and California may be looking at that in the near future.
Thanks, Bill. Really appreciate it. So certainly off-site PCI seems safe, if not safer, and that's good news for all those hospitals that want to try it. Thank you.
Very good. Thank you.